I had kind of been one of those kids who knows early on, but I didn't get around to it until I was 34. And I've always like, I've always had an interest in looking at people, and I've always had an interest in portraiture. But funny enough, I just had no sense of how feminine or not I was. And so when I transitioned, I didn't have like great expectations. I didn't know what to expect. I was just like, I just want to, get called ma'am or her on a regular basis. And I want to go to the best. And so I had a few people in my community who had been to Dr. Deschamps-Braly, and I thought, wow, that's really good. They look fantastic. And so I went there about a year and a half ago now, and I got my facial surgery about 6 months before quarantine started, so I didn't have much time to enjoy it out, but it's been in general like really fun and really pleasing.
So just to back up a little bit, was there any sort of thing that happened in your life that made you sort of decide to take the leap of faith and transition? Like, was there something going on that had held you back, or did you feel like there was some life event? Sometimes people have something that happens.
Oh yeah. Well, yeah, so I have two cute little kids. I have kids who are now 7 and 4, and they started calling me mom, dad, even before I had transitioned. And I would talk to my partner about this, my ex-partner, and she was like, they're just saying things. There's nothing going on. And yet, like at the same time, they would like look at me and say mom, and then correct themselves, dad, right? As if it was not intuitive for them to gender me male at all. And at that point, I was like, well, I trust the children because kids, have a way of um, seeing through societal expectations, and that kind of got me going in the direction that I am.
Yeah, there's something really unfiltered about children and their responses to us that I think, especially as trans women, I've certainly had small children express their opinions about me in a very unvarnished way that sometimes is wonderful, and sometimes, especially early on, wasn't my ideal. But yeah, it's really interesting that there are some people, I think, who have a certain clarity and sometimes see things before you do.
Yeah, yeah, exactly.
So you decide that you're going to transition, and you had some friends who'd had facial feminization surgery and had some good luck. Were you considering other people as potential surgeons, or were you set from the beginning on Dr. DB?
I was honestly like a little bit concerned about cost, and I wanted to uh, look into other places. But when I did my research, I understood that there are kind of like a limited number of surgeons who will do the full like removal and sanding back and putting back. And I thought, well, that just sounds like it's technically superior. And I am not the kind of person who comparison shops a ton, but since I live in Berkeley, California, and Dr. D's right across the way, I was like, well, why not just go to him? So he was, once I had done my basic research, I think he was the only contender.
So you mentioned finances, which is a huge issue for a lot of us. I had to pay out of pocket all those years ago, and I think a lot of people still do. was insurance part of it for you, or were you paying out of pocket? What was the financial barrier that you were dealing with?
Well, yeah, that was an interesting portion of it. So initially, I was starting to save up to pay out of pocket, and it looked like things were going to be like reasonable if I tapped all my savings and borrowed some money from friends and family and that kind of thing. Um, but I had pretty good luck because my company, Slack, had a special package with Cigna where they pay for specifically the certain cosmetic surgeries that other companies don't pay for.
Wow, that's fantastic.
I
So,
know.
so how did
Yeah.
you find that out?
Uh, yeah, there is I can't remember her name right now, but they have like a whole trans healthcare department at Cigna, and they will like they had a great trans woman there who was the like medical director of the unit, I guess, and she was like, "Yes, we will cover these things," and I'm like, "Really? You will cover facial surgery?" And she's like, "Yes." And so it took a lot of work. Um, Robin at Dr. D's office is really great in terms of keeping things coordinated. But after a lot of haranguing, we were able to make it go through.
Wow, that's what a huge relief. And it's really interesting because I've actually talked to a few other people who had insurance cover it recently. And I think there's a rumor out there that Dr. DB doesn't accept insurance. Did you have to pay out of pocket and then get reimbursed, or did it how did that work?
So they were able to get a letter of agreement between Dr. D's office and Cigna, and they I had to pay out of pocket for the deposit portion of it, and that was not reimbursed, unfortunately. But you know, it was part of the cost share, I guess you would say. And but then they did pay everything after that. And
It almost worked out like a deductible, essentially.
yeah, yeah, exactly.
Wow, that's really wonderful. And so you mentioned that it was fairly recently that you went to him. Can you talk about how you made your decisions in terms of what order to do things, and where facial feminization fit into your transition?
Right. Yeah. So I chose to do the face surgery first because it feels like that's the most important part. It feels like that's the um, you know, that's your primary connector to the world is your face. And I also went through his office to get breast surgery. And now I'm looking at a little bit of fat shaping. And so, yeah, I think it was really wise to put that up front because it was instantaneously like, oh, hello, young woman. Well, you don't, you know, you're not a very curvy young woman, but they still recognize me as myself. That's nice.
Yeah, well, I always said, I used to live in Chicago. I was like, if you can do okay in a parka, standing there, that you're probably doing okay, because everybody does see your face, as you noted. And so I kind of did the same thing. I worked from the top down, and
Yeah.
and I'm glad I did, because I think it helped me keep my job. I think, especially back then, it's like you could be fired without recourse all over the country. So it felt like an investment in that sense. But okay, so you make the decision to have it at that point, and how much time was there between the consultation and when you actually went in for the surgery? Like, what was your time frame?
It was about 6 months.
Okay.
Um, So yeah, we did, it's hard to remember back then, but we must have done a consultation in like February or March of 2019. And then we were in surgery on August 8th or the 11th, something like that. Yeah, so that was his booking window at the time.
And so when did you go full-time at work in that timeline?
Yeah. So I guess this was, yeah, I had already been full-time. And I guess it was funny because everybody at my workplace was really, they're really reasonable and they were really compassionate. And they were all like, yep, Bree's a girl. Okay, that's fine. But it wasn't until I come back that they're like, whoa, Bree's really a girl. Like, and in a way, I guess I didn't know how much I was not, quote unquote, passing before. But yeah, maybe my decision would have been different, but I think that, as long as you can, I think if you can be yourself, you should.
I agree. I think that once I had it, I felt like just sort of a slightly more authentic version of myself, if that makes sense.
Yeah.
And okay, so you had the consultation. Can you describe what the consultation was like for those who are considering it?
Oh yeah. So I feel like Dr. D read me pretty well going up. Like when I'm out and about, I can dress a little bit alternative. And so he maybe was a little more forthcoming with the nitty-gritty details of like what he was going to do. And he sort of assumed that I wouldn't blanch at seeing the pictures. And I didn't. I was like, yeah, show me. This sounds cool.
Now, when you say pictures, you mean surgery pictures or before and after pictures?
Both the before and after and the surgery pictures. So yeah, I kind of explained to him that I was like, this is what I want. I want, to sort of get back that thing that I feel like I missed by going through male puberty. And I want to have the face that I would have had if I had transitioned in childhood or when I was an early teenager. And then he kind of did some measurements on my face with his calipers and things. And he was like, oh, I think we can take this much off here. And he constructed the surgery plan pretty much right there. He was like, what kind of nose would you like? And I'm like, I like noses that have a little bit of character. And he was like, I really think you should have this kind of nose, like, a nose that sort of has a little bump at the end. If you want to look the most, like, if you want to be considered a woman in the way that you want to be. And I was like, okay. So yeah, he kind of went over where the incisions would be and what the surgery plan looked like overall. And then we started to talk about the risks associated with the surgery and the things that he would be expecting from me in terms of maximizing the result.
And
like
what were those things?
Like take lots of walks afterwards, make sure that everything stays very clean and doesn't get infected, call him immediately if there's a problem or anything like that. Which all seemed like pretty easy advice to follow. Yeah, and then once he was done with the sort of artistic planning, then he turned me over to the staff, and the staff were extremely compassionate and kind of walked me through what the process of getting it through Cigna, if that was possible, would be like. and otherwise how I might pay out of pocket.
And had you already decided before the consultation, or did that seal the deal? Like, when did you like make your absolute decision that he was the guy for you?
Uh, I I think it was when he started talking about the human body, and he told me this story about when he decided to be a surgeon. And what he said was he had been assembling model planes when he was a kid. And, he was a very mechanical person, and he liked, he would use knives and glue to get everything in the right place. And he split his arm open. And then he had to have that stitched up. And he was just fascinated by watching the ER doctor stitch up his arm, because he was like, oh, you can just do that with skin. That's amazing. And so, like, I don't know, I guess I felt like a little resonance there, because I I think that people are a little too precious about their bodies sometimes, maybe. Like, we don't approach them as what they are. And when I saw that for him, he had a lot of confidence, and he was like, oh, this is just flesh. We can move it around. We can change it. And I was like, yeah, he has the right attitude. That's what I want to see in a surgeon.
Wow, that's great. Yeah. And, it's always a leap of faith, I think, to get any kind of medical procedure. But I do think that making an informed choice and getting to the point where you're comfortable with the surgeon and their goals is so critical.
Yeah.
So you make the decision, you have the booking all set, and at that point, can you sort of take us through what it was like from like a few days before the surgery through when you go in for the last time to get things removed?
Oh, yeah. So let's
Just to
see.
sort of help people understand what the process is and what your thoughts were during that time.
Mm-hmm. Yeah. Um, yeah, I guess, like, getting close to the surgery date, I was kind of nervous. I suppose I was more nervous about having to arrive on time, having all my medications, making sure that I had followed all the instructions, and that I had, like, the post-op care plan set up. Um, I I suppose for myself, like, I had a little bit of finality about it. I was like, I'm going in. You know, I'm not sure what I'm going to come out looking like, but I think it's going to be better. And I I went and got all the medications at the Walgreens that he had sent them to, and there was a little bit of a back and forth, because they were like, we should really talk to you about all these meds. And I was like, but I'm going to the surgeon's office and he's going to talk to me about the meds. And they're like, well, okay, you know what these are, right? And I was like, yeah, okay. And so then I went into his office, and I uh, went over my chart with his surgeon's assistant, and went over, like, got the grilling where she was like, and you haven't done this, and you've tapered your estrogen medication down to half. So I guess that's part of why I was feeling a little nervous. It's like, yes, I did all these things. And she's like, okay, review this document. And I reviewed the document to make sure that all the dates were right. Start taking the steroid on this day, and take 3 doses this day, 2 doses that day, 1 dose the other. I made sure everything was correct. And then I went into Dr. D's office eventually, and he was like, "Hey, how you doing?" He was like really suave and personable. And he asked me, "Have you had any anxiety dreams?" And I'm like, "Yes. I dreamed that you were going to sew my eyes shut." And he's like, "Should I
That's a
tell
very
him?"
specific dream. I'm
Right?
sure that was probably the first time you heard that one.
I know. Well. So what he did was he looked at Jana, and he said, "Should we tell her?" I don't even know if I should put this on the video. And she's like, and I'm like, "You can't not tell me." And he says, "Yeah, we're gonna sew your eyes shut. Um, just one little stitch right there to keep them closed while we do the." And I was like, "Well, I'm good at guessing these things." So, um, and when your mind is kind of like looking for danger, all the weird things that could happen. So we had a good laugh about that. I was able to get picked up by his car the morning of, blisteringly early in the morning. And the check-in process at the hospital was a little bit halting because their check-in person for the surgeries, I'm not sure what you would what that unit is called at the time, um, the walk-in unit or something, but their check-in person had just arrived. Um, but eventually I got through that. I got hooked up to all the devices. I got compression stockings and my schmucks. I had all my piercings out. One of my piercings, I used to have a cartilage piercing up here,
Mhm.
and that one was already like a little bit marginal in terms of healing. So I just decided to leave it out. I decided not to put it in after. But I, remember being wheeled in by his OR nurse. And I remember talking with him a little bit in the operating room, and then black. And then I wake up and it's dark outside, and there's a nice woman next to me, and she's like, "Hey," and she's checking in with me. This is Dr. D's nurse, and she's really good about gendering me correctly. I have a long chat with her. I have like, a long, nice conversation with her. She was really personable. And I went over the plan for how to get out of that recovery room or that hospital room. And so I do my laps with my little attachments. And then once I've done the laps, I have the catheter out. That was kind of painful, but that's a can't be avoided in some cases.
And better than
Uh,
getting it put back in.
right. I don't want to have that happen when I'm conscious. I am really glad that didn't happen when I was conscious. Um, and then when I was discharged, I was driven back to my house, and I remember sleeping a lot for the first 24 hours or so and sleeping up at an angle, but kind of making it through, I guess you would say. Um,
Well, I know one of the
and
things that he's really focused on is trying to reduce your swelling and keep that to a minimum because he believes
right,
that helps the healing. So that's why he has people walk immediately. And
right.
um, what was your experience with swelling and discomfort from the time you were out of the OR through the next week or so?
Yeah, so I felt like a potato woman. I had tons of bandages on my head, and I had no idea what was going on underneath. Um, I was not to be perturbed by that. I had a bunch of Soylent on hand, and I was making sure to take the Tylenol and the acetaminophen, no, acetaminophen is Tylenol, the Tylenol and the Advil uh, on schedule. And as long as I didn't miss a dose of that, the pain was pretty manageable. I did not have to take any of the opiate medication. And I, since I was off of work and I didn't really have much shame, I just walked around with my dog for like a couple hours every day almost. And I got to the point when we had the bandages off, except for I think the nose plate, and then the second post consult. I guess my face was still pretty numb in most places because the nerves were still reconnecting. And there was still like a little bit of scum everywhere because I wasn't supposed to shower until everything had been off. But yeah, after the first dressings came off, it was way more manageable. I felt more like a human being. And then I just had the little nose thing in place and some of the packing in there to deal with the drainage.
And what did you notice when the bandages came off that first round of removal? Like, did you see any differences at that point, or was it a while later?
Oh yeah. I mean, I did see. And it was kind of unnerving to like be like, whoa, I used to have forehead there. Um, so I did see that something was different, but because the nose plate was in place, I couldn't quite see the full effect. And I was still a little bit swollen. So I still didn't kind of realize where I was going to be. And I think I went through this process even when all the bandages were off, where I looked at my face and I was like, I can tell that my eyes look bigger. And I can tell that he sure took off a lot of my forehead. But I couldn't process it as me or as a girl, right? And everyone was looking around me like, oh, really good. And I was like, great, I think. And it wasn't until I went back to work a few weeks later that people were like, whoa, no, he did a really good job. I almost didn't recognize you. And, a few months later, when I started looking at particularly like the before and after pictures that he had up, I was like, yeah, I looked kind of creepy before. Like, oh, that's a weird thing to say, but like, I guess I looked like I wasn't entirely present before I had the surgery. And I looked like I was kind of staring past. And it felt like I was more looking at the person after surgery.
And did it, besides that sort of appearance, did it feel like you were more present after you had the procedure?
Yeah, I would say so, because I think like in the sense that, we're really social creatures and we really like require one another to be seen, to feel like we're seen. And so I wasn't like constantly checking myself in Zoom or something to be like, do I look like a dude right now? I could just kind of stop wearing so much makeup. I could turn off my self preview and just kind of try to engage with the other person. And that's what feeling present is like in a way.
Yeah, that's an interesting way to put it, because I think a lot of us, we kind of dissociate from what we
Yeah.
see, and we also get so self-conscious, and those two conflicting forces kind of take us out of the moment and keep
Right.
us from being present for people. And I know in my case that facial feminization really did change the way that I interact with people as well. It's almost like you mentioned that, we're social creatures. It's like society's like a mirror that gets held up
Yeah.
to us and reflected back to us. And once people are responding in a way that feels right to us, I think it's like, it's so liberating.
Yeah. When people start smiling at you when you come in instead of giving you like the head jerk that they give to men. Yeah, that was really nice. And I wasn't recoiling anymore.
Yeah, there's something really lovely about kind of being able to make someone stay a little bit just by smiling and being nice to them that I really loved about after I had mine done, because
Yeah.
I think, I think I'm a pretty pleasant person most of the time. And so it was nice to have people respond to me in that way. And I really do associate facial feminization with that. So what were some of the things that, besides what we just talked about, what are some of the other things that were unexpected or that surprised you about the entire process?
Let's see. Unexpected things.
Like, were there little moments of joy or little surprises that made you happy, or a sense of relief, or something funny? Just anything that you weren't thinking would happen that did.
Huh. Um,
And it may have just gone exactly as you expected.
well, there was one funny thing that happened between Dr. D and me. Um, so he leans in as he's coming to visit me the morning after, right? Which was really cool. Oh, there were actually a couple. This is the first one, and I'll get to the next one. Um, but he asks me, "Do you remember what you said to me when you came out of anesthesia?" And I was like, "No, what did I say?" And he's like, "I'm not telling you." And he said it in that way that, surgeons as like part lizard people or whatever they are, like, I was like, I know that I can't get it out of him. I know that like there's no way he's going to tell me. And I was just like, darn. um, and then there was another cool thing that happened. A doctor named Samantha Mason, who has also had facial feminization surgery with Dr. D, who works in that hospital, came to visit me while I was in recovery. And I was like, oh, hello. And she kind of like, you know, she's really into looking gorgeous. She's great. She's a bit of a fashionista, but like, it's just nice to have someone there who had been through it all, just being with me like, yeah, it feels like you got hit by a bus right now, but you're going to look amazing in a few weeks. So that was kind of cool, like a little bit of extra community outreach from my fellow trans women.
Yeah, that's one of the things that I'm really hoping will come out of all of this, is that I've always been very focused on trying to build a community of people who are sharing their experiences so that others can make more informed decisions and just kind of help people through this, because it's a lot to deal with. And so that's a really lovely anecdote. And I've actually met Sam myself, and she's a very charming lady who yeah, she ended up looking great too. She's actually in the facial feminization surgery book that's getting updated.
Oh, cool. That's
She's
great.
in there. So I guess to sort of wrap things up, how would you say your life is different at this point?
Oh, geez. Yeah. It's I guess like I would say that I'm doing many of the same things. You know, I still have the same job, I still have my kids, but there's no longer any tension between what I am inside and what people see me as. Um, there's no longer any negotiation that goes on where people learn that I'm, you know, a different kind of guy from other folks. Even though, you know, I live in San Francisco and everybody is very charmed by queer people here in general, like nobody has prejudice. They just, you know, they don't, they don't like act surprised when I toss my head a certain way to get my hair out of my face. Or they don't, you know, when I talk about, oh, I better stay away from that because my thighs are getting a little big, they're not like, ha 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 ha. I'm like, no, my thighs are getting big. Um, and so, yeah, I feel like there's less tension. I'm, you know, still doing a ton of yoga, but it's not awkward. I don't feel like I'm invading anybody before. I just feel like one of the people. It's cool.
Yeah, it is so nice just to have what a friend of mine called delicious normalcy. You
Yeah,
know,
exactly.
just to kind of move through the world and just savor those simple things that I don't think I'll ever take for granted, but that most people do. Um, so one last question. So if someone were considering going to Dr. D for this work, how would you describe him to them? Like what do you think makes him tick? What do you think sort of sums up his philosophy and his techniques?
Let's see. I I feel like, let's see. The impression of him that I got was that he's a person who really cares about this community, you know, who really cares about helping people look their best and helping people look like themselves. And he's really dedicated to just conquering this little space, or, you know, being the top of the line in this little space. And I think that that's really exceptional because as trans people, we can often feel like we're outsiders, like we're outcasts, like we're the shabby corner of society. And he wants to make us feel like royalty, right? He wants to make us feel very valuable. And you go into his office and it's like a little intimidatingly ritzy, and the coffee is excellent. And like, I was like, geez, I didn't know that it could be nice like this. Um, and like, I think at heart, he's kind of a big nerd and kind of a, kind of like an eternal adolescent. And I really like that about him. You know, I like that he has fun with it. And I like that he has growth in his mindset, right? He's not stopping. It seems like he's got plans. So
Well, that is a lovely summary. And yeah, you know, if I were to sum things up as far as my experience with facial feminization, it's the same thing. It's that it was just so refreshing to connect with Dr. O because you could just really tell that he cared and that he he was constantly trying to improve his craft. And I always get the sense with Dr. D that he's really doing the same thing. And yeah, you know, I'm hoping out of all of this that some people will see this and it will get them thinking about possibilities for them that maybe they before this weren't thinking about. Your story is very inspiring, I think, because of how this came about in your own life, and obviously your results are spectacular. So, so I'm really glad that you took a moment to speak with us today. And do you have any final thoughts or comments just to sort of, you know, give someone some inspiration if they're, you know, unsure about their future or worried about, you know, how their family's going to react or how their job is going to react?
Yeah, I think that when people, a lot of people have a hesitation to getting aesthetic procedures and cosmetic procedures because they think it's going to look fake. And, you know, there was certainly a period of time where, you know, my nerves were coming back into my face and I didn't have full command of like my brows and my expressions and everything. But even people who, you know, I would say were otherwise kind of indifferent to me, or who were maybe a little bit reticent about LGBT people in general and trans people in particular, it felt like I helped move them into a place where they believed us a little more, because seeing is believing. And I mean, I think one of my managers at work even referred to Corin and myself, who are both getting the surgery at the same time, as terraforming agents to make that, you know, male-dominated engineering department a little bit better for queer people and trans people.